you. Please stand by. You will now be placed into conference.
Of family organizations, as well as those providers who work with families and children, and also schools, social workers, anybody who's interested in the issues of children and youth with mental health and behavioral issues. We have a lot of programs. I see a lot of names that I've never seen before, so welcome. If you want more information about the Coalition, you can get on our email newsletter list, which is on our website at mdcoalition.org. And in November, we have two presentations coming up. One is on November 10th on ADHD. It was presented by two child psychiatry fellows from the University of Maryland School of Medicine. And then on November 15th, to recognize National Adoption Day month, we have a presentation on adoptive parenting issues. And so look forward to those. And now I'm going to turn over to Ann Geddes, who is a colleague of mine at the Maryland Coalition of Families, somebody that I respect a great deal and turn to often for advice and information and help. And a lot of families in our state will also do that. So I'm going to introduce you to Ann now.
Hi, I'm Ann Geddes. As you can see on the screen, I'm the Transition Age Youth Specialist with the Coalition. About 5 years ago, we held focus groups across the state of families with youth with mental health needs who were transitioning from high school into adulthood. And one of the major things we heard from families is that they lacked a coordinated place to get one place to get coordinated information about the transition process. And that's what this presentation is about. We've got a lot of slides here to cover. I'm going to try to leave some time at the end for questions. So let's get started. If I can find, here we go. All right, there we go. Okay. Again, because we're covering a lot of information today, this presentation is based on a handbook that I wrote, and the second link down there is the link for the handbook. The first link is for the Maryland Transition website, and that has a ton of information about transitioning for all disability groups. And I recommend that you go there also to get, if you're interested in this topic, to get some additional information.
It will be on the chat.
It will be on the chat, those websites. So if you can't write them down right now, they'll be appearing on the chat box. Next slide. Quickly talk a little bit about transition age youth development. Did we miss a slide? No? Okay. No. Youth with mental health disabilities. Transitioning is youth for all youth. Transitioning to adulthood is difficult for all youth. The 2000 census found that the average age that a young adult left the house for the last time was age 30, and that's for a typical youth. Youth with mental health disabilities have the social emotional delays, such as they may be lacking in social skills, may lack the ability to handle stress, that make it particularly difficult for them to make that transition successfully. At the same time, they have some developmental characteristics that are more typical for youth. We see in adolescents, they seek differentiation and independence from their parents. They are strongly want to fit in with their peer group, and one of the consequences of that often is that they don't want to identify as someone with a disability and may refuse treatment or special services, which includes taking medication. It's not unusual. It's actually developmentally normal that this age group decides to stop taking their medication. Nonetheless, despite the difficulties, transition plans for this population must be youth-driven. They need to be allowed the dignity of risk, to learn, to make mistakes and learn from them. And the goal of the parent is to be there kind of with a safety net when needed, but to stand back and let them drive their own transition plan. Starting out with high school transition planning, there are school guidance counselors that are available to all students. There's also school transition coordinators, and that name varies from jurisdiction to jurisdiction, but usually IEPs should automatically be hooked up with someone who is like a transition coordinator at the age of 14. Those transition coordinators are also available to help students who are on 504 plans, but the family kind of needs to advocate and seek out those coordinators to work with their student. Also, DOORS representative, and we'll be talking about DOORS a little bit later. DOORS stands for Division of Rehabilitation Services. Should be at a youth IEP at the beginning of their junior year. That should be automatic, but if you have a 504 plan, you'll need to seek out that, make sure that referral gets made. Under the Individuals with Disabilities Act and transition planning, it's required to begin here in Maryland at age 14. The students are supposed to be part of their IEP team and talking about their transition goals. Assessments are supposed to take place that helps them define their transition goals. And at age 16, the transition plan is expanded. And one of the things that there's a special sheet in the IEP that's supposed to look at what related services and a student might need to successfully transition into adulthood, and the schools and DOORS, the school should make the referral to DOORS, and the school and DOORS should help families make linkages to those agencies, such as the Mental Hygiene Administration and Supported Employment Services, which we'll talk about a little more later. One thing that's really important to this population we're talking about, youth with mental health disabilities, is that they have a paid work experience before they exit from high school. Study after study show that youth are more successful in employment after high school if they have that first paid work experience in high school. Work study, or some places it's called work-based learning, is available to IEP students. If they meet certain criteria, if they have room for it in their schedule, that can be an issue depending on where they are with their HSAs. Can be an issue, and if they show appropriate behaviors that they can work in the community. The transition coordinator person should help arrange a work-study experience if that's possible for the student. For students on 504 plans, and also for IEP students, but students on 504 plans do not have access to work-study programs. There's the Career Technology Education Program, which basically consists of taking 4 or 5 classes and then having the opportunity to do an internship or a paid work experience in the community after you finish that sequence of courses. So both of those options are really important to youth who have mental health needs in being successful after they graduate. So kind of in summation, looking at an IEP student versus a 504 student, the IEP student should have a transition coordinator. They'll have a transition IEP with 1 sheet or 2 sheets dedicated to describing what the goals are and what services are going to be needed. They have the opportunity to do that work-study experience if it fits in with their schedule. Some jurisdictions have also the ability to do a summer work experience, particularly those youth who can't fit a work-study experience into their schedule because they are having to take classes to graduate. In some jurisdictions, there's summer work available. Your transition coordinator should be able to hook you up with that if that's a possibility. Students with IEPs will get an exit document, which becomes important later on when we talk about continuing education and employment. It lists the accommodations that students have had in high school and what might be helpful for them to have in continuing education and employment, and it has other documentation like assessments that have been done. IEP students should also have that automatic referral to DOORS. The 504 student families and youth need to advocate more for those services, but there are services available to them to help them make the successful transition. So let's talk about DOORS. It's Maryland's Vocational Rehabilitation Agency. Its goal is to help people with disabilities find work. It's important to remember when talking about DOORS, they serve all age groups and all disability groups. Sometimes, I know I thought that they served youth with emotional disabilities, and the truth is they serve ages 16 to 64 of all disability groups, developmental disabilities, intellectual disabilities, and along with people with emotional disabilities. They have limited funding, and the services are based on eligibility. They're not an entitlement like an IEP, a free appropriate public education, when a student is in school is an entitlement. DOOR services are not. You may have a disability and still be not eligible for DOOR services. When an individual is referred to DOORS, they'll perform assessments to determine whether or not a youth is eligible. And if there are 3 disability categories. If your youth is found to be not significantly disabled or significantly disabled and you think they should be found to be most significantly disabled, you may appeal their decision. That information comes along with DOOR's determination on how to make an appeal. And there are families, I know, who have appealed and gotten a more favorable ruling. So the referral to DOORS, as we said before, should be automatic for the IEP team. It's helpful to have that at the beginning of the junior year. So if a student's annual IEP is scheduled for the spring, it's helpful to have that meeting in the autumn so that a DOORS representative can be present. Everybody should know that anyone can refer to DOORS at any time, and that link there shows, or you can call that number and get information, get the form to make the referral to DOORS. DOORS has, because they have limited funding, there are waiting lists, and waiting lists can vary depending upon where they are with their funding, but what the waiting list basically means is how long you're going to wait for services. Most significantly disabled are served first, then significantly disabled, and if your youth is found not significantly disabled, they will not receive services. There's not funding to go to provide services to that population. These are the basic services that DOORS provides. They do interest, vocational assessments, interest and ability assessments. They provide job counseling to individuals, like and job search skills. So they'll work on things like how to write a resume, how to write a cover letter, how one should present for an interview. They teach youth how to use the one-stop job centers, how to look for jobs, and they let students know the one-stop job centers have a lot of programs available just to anybody who's using their services, like resume writing and interviewing techniques, and they hook youth up with those one-stop job centers. They also have a campus in North Baltimore called the Workforce Technology Center, and there are certain programs available there, training programs. Some of the I think there's 10 or 11. Some of them, for example, are automotive detailing, tire and lube service, food service, security guard. That's 4 off the top of my head I can think of. They're typically 3 to 5 month training programs. There is a dormitory services available up at the WTC. Those services that service is provided Sunday through Thursday, so individuals who don't live close or can't easily commute have dorm services provided up there. Except for the assessments and the job counseling skills, there is payment required, like for the training programs, and there is a schedule that's based on family income. So again, it's not an entitlement. Payment is required for some of DOORS services. For youth with emotional disabilities, a real important piece that DOORS does is that referral for supported employment. And let's talk a little bit about supported employment. If a youth is found most significantly disabled, DOORS is supposed to make a referral to the Core Service Agency, which the Mental Hygiene Administration is the state agency that administers mental health programs for the state. Core Service Agency is in local jurisdictions, and they administer it on the local level. DOORS is supposed to make referral to the core service agency for supported employment services. And then job services will be provided through a contractor with the local core service agency and not doors. It's specified as an evidence-based practice that certain contractors are trained in providing supported employment. Supported employment is appropriate for both youth who are attending continuing education and those who are not, and that's a lot of youth with mental health disabilities are maybe not going to be a full-time four-year college student. They want to take one or two courses at a community college and work part-time. Supported employment is very appropriate for that. It provides a job coach who works very closely one-on-one with the youth. Supported employment is also available for adults, but we're talking about it in the context of transitioning youth. And they provide ongoing proactive support. They often meet with the youth in the community, and instead of having be a clinical setting where you have to go see your job coach, and they are there for as much as the youth wants them to be involved. It provides, the philosophy is that the person should be working in a mainstream job in the community, paying at least minimum wage, and that it should not be like an enclave setting where everybody there is disabled. They should be working with people who are not disabled. The supported employment philosophy is that an individual's preferences are important, and that means that if, when I talk about this, I cite the case of my daughter who wanted to be a tattoo artist, and I thought that was crazy. I thought that was an outrageous career choice. But her job coach said, okay, you want to be a tattoo artist, what do we need to do? Well, you'll need to take some courses in first aid. You might need to take a art course at the community college, and let's start calling around tattoo parlors in Baltimore City and seeing if they're hiring. The job coach goes with the individual and what their job interests are. They don't say, well, that's a ridiculous idea. The person should choose as much or as little support as they want from the job coach. If they just want the job coach to work behind the scenes, that's okay. If they want the job coach to come in with them when they interview, that's okay too. It's the individual's choice. They help an individual disclose whether or not to decide whether or not to disclose their disability and the pros and cons of doing that. And follow-along supports are continuous. It's not like, well, we've got you a job, we've closed the case. They will continue to work with the young adults as long as they want. So post-secondary education, along with employment, this is the other big concern for transitioning youth is what are your education options. There's typical four-year colleges which look at your grades. They require SAT scores or PSAT scores and look at what extracurricular activities you've been involved in order to make admission decisions. Two-year colleges are typically community colleges, and they do not require SATs or standardized testing. They do not look at high school scores. They do, however, require you to take a basic proficiency test in English and math, and if you can't pass that test, then you're required to take remedial classes in order to continue on. There are VOTEC schools. There are a ton of them. They vary widely from being very well respected to some that are a little more fly-by-night. And if you're looking at a VOTEC school, you should look closely and get recommendations from other people if you can. Apprenticeships are highly competitive, usually involve 3 to 5 years training, but that's an appropriate option for some of our youth. And there are the DOORS training programs, which I mentioned earlier, 3 to 5 months, specific vocational, with a specific vocational aim. Families need to know that for almost all forms of financial aid, you need to fill out the FAFSA. That's the free application for federal student aid. And in high school, a guidance counselor or transition coordinator should be able to hook you up with how to do that. You can go online and type in FAFSA, and the form will come up. When a youth with a disability, mental health disability, goes on to continuing education, if they had an IEP in high school, that goes away. Those accommodations are no longer part of their educational plan. However, Section 504 of the Education Act, which prohibits discrimination, allows that reasonable accommodations be provided to students. The last sentence there is very important, as long as the accommodations do not fundamentally alter the required coursework. So it's not like you can have assignments waived or really major projects waived, but certain accommodations will be given to you. In order to access accommodations, the student, not the parents, must make an appointment with each four-year college and two-year college, and some vocational colleges have disability support services offices. And if a parent tries to make that appointment, I've been told, working with a lot of families, that they're told, the youth needs to make the appointment. The parent can go along with the student to that appointment, but it needs to be the youth reaching out for support. The Disability Support Service Office will require documentation of the disability, and it may be enough that what's provided in the exit document, a letter from a provider saying they've found that this individual has a disability and the method used to determine the disability. The important thing, I think, is that some schools require more documentation than others, and if you're looking at your college, that you see ahead of how stringent the requirements are. There are places that require that a neuropsych evaluation have been done in the last 3 months. So you want to know that before going in, what documentation is required to access accommodations. So accommodations that might be allowed for students with mental health disabilities, these are some of the more common ones, especially like if a youth ends up being hospitalized. You can have allowance for excused absence and tutoring to make up coursework for the time you were in the hospital. Also modified deadlines for assignments, extended time on tests, freedom from distractions when testing. These are accommodations, but that they don't fundamentally alter the work required for a class. Okay, moving on from employment and education, let's talk a little bit about supplemental security income, SSI. There are upsides and downsides to SSI. The upside is that if you're found eligible for SSI, you'll receive a monthly check. The base of that monthly check is $674. That will may change depending upon whether or not you work, what you get paid, but that's the maximum amount. The big benefit of being found eligible for SSI is you automatically get Medicaid, which is a public health insurance plan. And for our youth who have mental health disabilities, in order to receive services through the public mental health system, you need to be, in most cases, you need to be Medicaid eligible. So that's the big plus. You also have automatic DOORS eligibility and funding. We've talked about there was the DOORS services other than assessments and job counseling. There was cost involved. That is waived if you're on SSI. And a law passed last year that provides tuition waivers at Maryland community colleges for all students who are on SSI. It's important to remember that an exception to that is, that the tuition waivers provide for credit courses. Non-credit courses such as the remedial reading or math a student may need to take or other non-credit courses are not waived. The tuition is not waived. So in order to be found eligible for SSI, since we're talking about transition age youth here, I'm not going to talk about eligibility for children. If you are eligible as a child, you have to be reassessed at age 18, and the assessment criteria is more stringent. But families should have their youth apply for SSI, or really families need this is something that would be very difficult for an 18-year-old to do on their own. It's a really complicated application process. But when a youth turns 18, they're eligible for SSI based on their own income. Their parents' income is not included for eligibility status, which often is a hindrance to youth under 18. The definition is that to be eligible, you need to be medically determined, have a medically determined physical or mental impairment that results in the inability to do any substantial gainful activity. Basically means you can't really work and support yourself, that you're unable to do that. You have to make less than $980 a month if you're currently getting any income, and you have to have asset limit of $2,000. You can't have more if there's a college fund somewhere or a bank account. You need to make sure that the youth's assets are under $2,000. The application process is difficult. And I'll say something here. I didn't talk about the downside. There are people who argue that the downside of applying for SSI and getting SSI is that it creates dependence on public benefits, and that it provides a disincentive to work. And I'll talk in a minute about the incentives that SSI has put in place to counter that disincentive. But that's something that the youth and the family should think about. It shouldn't be automatically assumed that applying for SSI and going on SSI is a good thing. There's a quote I've heard, 1 out of 1,000 people who go on SSI come off of SSI. So there is a fear that it creates kind of a culture of dependency. I meant to say that on the earlier slide. The other drawback to applying for SSI is the application process itself, which is very cumbersome. You can now fill out an adult disability report online. If you go to Social Security's website, it is difficult, cumbersome to do online because there's so much information that's required. And I remember filling out the application for my daughter. I took a whole weekend where I didn't do anything except fill out the adult disability report. So you can, in order to get a hard copy of that, you can call that number, and they will mail you a copy to fill out at home at your leisure. But if you want to, you can also fill it out online. Then after you have the adult disability report filled out, you make an appointment at the local Social Security office where you'll go in person to go over the disability report, and you need to have the names of all the providers, hospitalizations, IEPs, any other information that might help with the disability determination. There's also certain documentation that's required, original birth certificate, Social Security card, that you have to bring with you at that initial appointment. Sometimes Social Security will determine that they want their own psychiatric evaluation done in order to make a disability determination. That you do not have to pay for that. That's done at SSA's expense. Then you'll get the determination whether or not they find that your child is substantially unable to do any gainful activity and you're eligible for SSI or not. It's not uncommon for youth with mental health disabilities to be denied on the first application, so you should plan to appeal. And with your letter from SSI, the Social Security Administration, they will tell you how to do that. If you lose on your first appeal again. Statistics show that often people who are denied the first time and second time are ineligible on the third appeal. Managing SSI benefits can be somewhat cumbersome as well. When a youth gets a job, you need to immediately report that to SSI and the income they're receiving. They're also going to want to see the pay stubs, so those need to be saved. You immediately need to report any address change. And if your youth is living with you, if you do not charge them room and board and have an agreement written up to that effect, SSI will determine that as income in kind, and deduct that from the $674 amount. So if you want your youth to get the full amount and you're providing them with room and board, you need to write up an agreement charging them for that. Social Security Administration may determine that your youth is not able to handle their money on their own and name you representative payee. It's most common for family members, especially if the youth is living with you, to be named representative payee. And in that case, the check will go directly to you for you to disperse for the requirements, financial requirements of your child. Representative payees need to fill out annual reports stating how the money was spent, so you'll need to keep track of that. Talked a little bit earlier about incentives. SSA found that some people were not working because they didn't want to lose their Medicaid. That's such a important benefit of being on SSI. So the Employed Individuals Disability Program was started up so that people could lose SSI. In fact, you can make up to $66,000 a year, but keep your Medicaid. So you're not getting that check. You're not getting that $674 a month check or even a $1 a month check, but you are keeping your Medicaid. The asset limit is very high as well, $10,000, and that doesn't count home vehicles or any retirement programs. There are premiums that kick in at some point. I think it's at $33,000 a year, but I'm somewhere around there. And the premiums are graduated, so depending upon what your income is, it may be nothing or $5 a month up to, I believe, $50 a month. So if you don't have Medicaid, there are other health care options. One, people have private health insurance. We'll talk a little bit about the new Mental Health Parity Act that families should know about if their youth is on their insurance policy. They're still working out the details of the Mental Health Parity Act, but there are some things that are clear, and that's that they may not charge separate deductibles for mental health care and somatic care. There's one deductible that's allowed. They may not impose different limits on the number of visits. It used to be quite common that they would only cover 6 visits to a therapist, and then after that you had to pay the full amount. Now, unless they limit your visit to a somatic care to 6 visits, they can't limit the number of visits to a mental health professional. And insurers may not charge greater copayments. That was also very common, that if you saw a mental health professional, you'd have a $50 copayment, whereas if you went to see an optometrist, you'd have a $20 copayment. That's not allowed any longer. They must charge the same copayment for mental health services as somatic services. So most people should know about the very controversial Patient Protection and Affordable Care Act that was passed last year. This allows families, used to be that families could not keep their young adults on their insurance policy unless they were a full-time student, and then it was usually to the age of 22. Now families are allowed to maintain dependent children on their health insurance until the young adult's 26th birthday, and that doesn't matter. They don't have to be a full-time student. They don't have to be a student at all, and parents are allowed to keep their child on their private insurance. The second bullet there, it was true and it remains true that a parent may maintain a dependent youth indefinitely on their insurance policy if those conditions are met. They're dependent, they're unmarried, and they're incapable of self-support. In that case, they would undoubtedly have also been found eligible for SSI. So we talked a little bit earlier about Medicaid. Some people are confused. Medicaid is the same thing as medical assistance. They're different words for the same program. It is different, however, than Medicare, and we're not going to talk about Medicare today because that usually, not always, but it usually doesn't apply to transitioning youth. Medicaid is a public health insurance plan. The eligibility we talked about, if you have SSI, you're automatically determined eligible. If you're on the Maryland MCHIP, the Maryland Children's Health Insurance Program, you're eligible for Medicaid to age 19, but then you lose that health care coverage. Youth who are in foster care at age 18 are allowed to keep Medicaid until age 21, and a new provision is that if you have a dependent child, this is in Maryland, and are of low income, you are eligible for Medicaid. And there are other medical conditions. Low-income pregnant women are also eligible for Medicaid. Other health conditions as well. So if you want to access services, you want your young adult to access services through the public mental health system, the eligibility criteria is primarily you need to be on Medicaid. There are a few exceptions to that, but I won't go into those details. It's rather complicated. Again, if you look at the handbook, it lays out what the exceptions to that might be. But in general, you need Medicaid to be eligible for services through the public mental health system. Some of the services provided through the public mental health system are psychiatric inpatient care, that's like hospitalization, psychiatric day treatment, that would be partial hospitalization, visits with clinical professionals, psychiatrists, social workers, psychologists. Medications are covered. Residential treatment is covered. That applies to youth up to age 21. At age 21, none of the residential treatment centers keep youth. They have to exit by age 21. Other services provided by the public mental health system are psychiatric rehabilitation programs. Those are called day programs, and they're typically more appropriate for older adults who have chronic mental illness, but sometimes transition age youth are for some transition age youth, those are appropriate programs. Residential rehabilitation programs, that's housing program where you typically have two or three consumers living in a house that's in a townhouse or an apartment that's integrated into the community with staff support. Supported living, there's more independence, but staff support is provided. We talked about supported employment. That is a service for transitioning youth, but as people are older, you can access supported employment through the public mental health system. Intensive case management coordinates services with all providers of a young adult who has mental health needs. And in 1999, the Mental Hygiene Administration made some funding available for programs that are specifically designed for transition age youth. I'll talk about some of those. In order to be eligible for the programs, again, you must be on Medicaid. Some counties have these programs, some do not, and the programs vary from county to county. If you look at the handbook, there's a list of each county and what programs are available in that particular county. But the services for TAY include residential rehabilitation programs. That would be a home where only youth reside. In a typical RRP program, you might have 30-year-olds living with 60-year-olds. The transition age youth RRP programs, you only have young adults, and there is a dedicated program manager who is trained to work with young adults. Other services provided, and again, these are designed for the transition age youth population, case management, financial support, supported employment, and supported education, which is trying to expand out in the states. That's where you can have an individual help the young adult get applications made, make the appointment with the Disability Support Services Office, provide support outside the classroom, what might help for you to be successful in school. That's provided in some of the TAY programs. So for young adults who don't have Medicaid, who aren't on private insurance, there's one other option for health care, and that's the Maryland Primary Adult Care Program. The eligibility requirements are much less strict than SSI requirements, Medicaid requirements. You just need to be 19 or older, not eligible for Medicare. There is an income limit and an asset limit, which is a little bit higher than for SSI. And the important provision, since so many young adults with mental health disabilities are living at home with their families, they will be counted as on their own income and not their family's income if the family does not claim the use as an exemption for income tax. So they can be, it doesn't matter how much the family makes, they'll be eligible based on their own income. Primary adult care pretty much is what it says. It provides free visits to primary care providers. The idea is to be preventive and proactive in healthcare as opposed to going to ERs to get services. However, it does provide specialty mental health services, including, as you see, visits to psychiatrists, clinicians, outpatient substance abuse treatment, PRP programs, medication. One of the things we heard in our focus groups is that youth were having to go off their medications because they couldn't afford them when they turned 19. PAC covers medications and mental health-related lab services. What PAC does not cover is the high-end services, emergency room visits, hospital stays, and any kind of specialty care like an optometrist or an endocrinologist or any of those specialty somatic care services. It does not cover. So it's just primary care services and then the specialty mental health services. There's the website to apply. You can, the application is online, or you can call that number and they will send you an application.
Okay. Sorry.
Finally, let's talk a little bit about housing. In the beginning of this presentation, I cited the quote from the 2000 census, which I'm sure is going to be more depressing for the 2010 census, that the average age that a young adult leaves the family household for the last time is age 30. We can expect that probably process is going to be delayed for youth with mental health disabilities. Where they're typically living is at the home with their family. There are some subsidized housing options available. Youth coming out of foster care, there's some independent living programs that they have access to. There are the public mental health system, residential rehabilitation programs we talked about earlier. Those tend to serve, they do serve those with the most significant disabilities. Youth who are coming out of residential treatment centers, youth who are homeless, they have waiting lists. It can be difficult to get in. That doesn't mean you shouldn't pursue it, and you would pursue that through the local core service agency. But the waiting lists are long, and if you don't reside in a county that has a TAY RRP program, it's particularly difficult to get in. There's also Main Street Housing, which provides subsidized housing for for all people with mental health disabilities. You have to have an income, however, a steady income in order to be eligible for housing through Main Street. They're in about, 1/3 of the jurisdictions in the state. And there's Section 8 housing, which most people know about. It's got very long waiting lists. I did, however, hear a presentation just last week from a woman who, when her daughter was 18, she put her on a waiting list for Section 8 housing, and then when she was 24, about ready to really live independently, her name came up on the list. So it doesn't hurt to, if you're in a jurisdiction where the list is not closed, and in some jurisdictions the lists are closed. But if you are living in a jurisdiction where it's not closed, it doesn't hurt to get your child's name on that waiting list. Here are the private pay housing options, the typical college dormitory, tuition, room and board, the room piece of that payment. Other places to look for roommates are college and community college message boards. I was at Towson University last night, and there were plastered all over the message boards, roommates wanted. And then Craigslist, and my daughter found 2 houses, 2 sets of roommates to live with through Craigslist, and I think others in our office here also have, for their young adults, found living situations through Craigslist. You have to be careful and interview the people ahead of time, but it is a way to be able to affordably live outside the family home. That's my contact information. If you have any other questions, please call or email me. And again, we went through a lot of material today in a really quick amount of time. So please feel free to contact me, or again, if you can look at that handbook, it has a lot of information that I wasn't able to cover. Also, I offer Navigating the Transition Years workshops across the state. I'm going to be doing one in Baltimore City, and I don't have the dates with me. I think
November 7th and November 14th
is Montgomery County. I think the Baltimore City one is on December 3rd. That's a Saturday. The Montgomery County one will be a 2-session course. Again, we go into things in more detail. I bring in some outside speakers from the school system, and in Montgomery County we'll be bringing in outside speakers from St. Luke's House. Baltimore City is a 1-day morning workshop, so we'll be a little more constrained for time. But there is somebody coming in from Baltimore City Public Schools to present at that workshop. So there's a ton of information here, and I'm sure you have a lot of questions, but tried to cover the basics as best I could. So are there questions coming up? We have some time for questions?
Yes, we do. We have, if you have a question, you can click on the little hand icon, and I'm not sure if we can unmute or. Oh, okay. So, and actually now it even gives us the first person to raise their hand.
Okay.
Carol.
Yeah.
We have so many call-in users that if a call-in user tries to raise his or her hand, we won't know which line they called in on. So.
Right. Well, the only other option is if they're also there, they can, and they don't have a little telephone next to their name, then they can type in the chat.
Yes, that's right.
Right? Okay. So anybody who doesn't have a telephone next to their name can type in the chat. Okay, so it looks like we have Penny Walters. Can I unmute, or do you have to?
Well, I think that...
Oh, I can. Penny, do you have a question?
No, I don't. Thank you.
Okay.
Carol, those hands that are still up are people who never lowered them from the beginning, I think.
Okay. So if you have your hand raised, please, and you don't want to ask a question, please unraise your hand so that we get you off. Okay. Here we go. Let's see. Heather? Nope. Looks like we don't have questions. All right.
Questions?
No questions.
There's one from Chiquita.
Can you send email on the workshop? The best way to get information about all of our programming is by going on our website, and we do have right on the front page find us on Facebook, and all of our programming is on that. Scroll up and down that, and you'll get everything off of there.
How you doing, Michelle?
Chiquita, your line has been unmuted. You can go ahead and ask your question.
Oh, great. Thank you. I didn't know. I listen to a lot of these workshops and conferences. Can you hear me?
Yes, ma'am.
Yep.
Okay, great. And I never hear anyone speak about SSDI versus SSI benefits and services, because there are some of us that have youth that get SSDI, and my son is one of them. So I tend to want to hear both sides, but I only hear information on SSI people and nothing on SSDI. Why is that? Is it that few people where their youth get SSDI?
Yes.
That's trying to, again, get a lot of information in a short period of time. Transition age youth typically are, except in certain circumstances, are typically eligible for SSI and not SSDI. But I can tell you, if you call the Maryland Department of Disabilities, they have a benefits person who can answer any of your questions about SSDI. The Maryland Department of Disabilities, and ask to speak with them.
I know them well. All right. Thank you.
Okay.
Okay, any other questions? All right, I'm just going to, there's 2 questions on the chat. Let's see if we can answer them. We're not going to give, okay, Tony asked it in general, so everybody can see his question.
So essentially your question is, does doing homeschool affect transition services? And it makes it yes. You're still eligible for all the services that you would be eligible for if your child were attending a public or non-public school. But you have to advocate for them. You have to connect with the homeschool to get that referral to doors, or make that referral to doors yourself. You just need to be more knowledgeable. I'd encourage you to read the handbook about what services your child is entitled to, because they still can access them. You just have to advocate more stringently for yourself, for your child. Is there another question up there? The full amount, let's see.
If a SSI is reduced by 1/3 because there isn't a room and board rent agreement, or Social Security office did not accept the form of room and board rent agreement that you entered, you've submitted, is there anything you can do to change that so you get the full amount?
I'm not aware. That's a good question. I'm not aware of. So there's an answer there. You can file an appeal. Typically, all you need to do, and I've been told, and I myself have had my daughter write up an agreement saying, I agree to pay my mother my mother Ann Geddes $250 a month rent. And when we had our appointment with the Social Security office, we handed them that just basic sheet of paper. It's not a legal document or anything, and they accepted that. If you're having problems getting SSA to accept that document, one of the callers said, you can appeal that.
Okay, and there's another question. Do I have to get my adult child's consent to receive the discharge summaries from hospitalizations when she, I guess it was a child, or can I get them from a private insurance company? Yes, you'll have to get your adult child's consent to receive any of her medical records. And when you're applying for SSI, she has to sign all of the forms, even if you complete them. She still has to sign all the forms.
They're legal adults. They're protected, and they have to, under HIPAA laws, and they have to provide their consent. That's one thing, again, that's in the handbook that I didn't talk about today was changing legal rights, and things like advance directives can be filled out ahead of time that your daughter would fill out to allow her providers to share information with you. And you can also just on a sheet of paper, write, I allow my provider blank to share information with my mother and father or whoever that they want to give permission. It doesn't need to be notarized. It doesn't need to be legally drawn up, but it does need to be in writing.
Tony, I just unmuted you because it looks like you may have a question. I guess not.
Can you hear me?
Oh, yeah.
Can you hear me?
Now we can.
Oh, okay, great. Like I said, doing well, thank you. The transition is a concern we have because we're considering homeschooling, and with your response,
Ida, do you have another question? Let's see. Chiquita, do you have another question?
Yes.
Go ahead.
The advanced directive. I have a lot of forms such as that for my son. And some people said I had to get it redone every so often. But when I was reading the documentation, it didn't say that. I was under the impression that it's active until he decides to revoke it. Is that true, or do you need to get it renewed every so often?
You don't need to get it renewed, but your child may revoke it at any time.
Okay, that's what I think.
But once it's drawn up, that's sufficient.
Okay, that's what I thought until somebody said differently.
Okay, thank you. Okay, unless we have any other questions, we're going to sign off. It's 1 o'clock. Thank you all for participating. Thank you for the many great questions and for your insight and stimulating conversation.
Thanks.
Bye-bye.
Bye.